I would say that 80% of the patients that walk into our doors suffering from EDS or POTS or complex regional pain syndrome or other chronic pain conditions also suffer from GI dysfunction. So what I mean with GI dysfunction is they have a hard time going to the bathroom, or they have runny tummies all the time, or they have nausea and they cannot digest food, they have tons of food allergies. Sometimes they have a hard time swallowing their food, or when they eat they're in severe pain afterwards. Now the sad thing with a traditional medical approach is that most medical allopathic physicians today still do not recognize that the body should be treated as a whole, and you cannot treat it like a car engine where you just take certain parts and replace it or fix it or medicate it or do surgery on it and then the whole engine is going to function well again. Everything works with everything else. Everything fits together into this intricate 3D puzzle. And it is my belief that vagus nerve dysfunction is very big in these conditions and also will cause this upset with the stomach and digesting food. The vagus nerve is a nerve that runs through the carotid artery and internal jugular vein. And that nerve is vital. It connects with every single organ from here to here, including the bladder and the stomach and the large and small intestines and your lungs and your heart. And that nerve, 100% of the time in our experience when we've treated hundreds and hundreds of patients with these conditions, is not normal. That nerve tells your GI system how to function correctly, how to heal correctly. It also, we're now finding with research, will act as a ladder where if you have an infection in the GI tract, and that infection could be one of many different things, very often is one of the herpes virus in that family, like chickenpox or cold sores, traditional herpes, the Epstein-Barr infection. Those viruses and bacteria can move up that ladder just like it's climbing up a ladder, and then the brain becomes inflamed as well. If you have inflammation in the gut, you're going to have inflammation in the brain, and you'll have this lack of memory, inability to focus, foggy mind. So the first step we use in approaching this is opening the communication of the vagus nerve that almost acts as second spinal cords, so that the communication between the gut and the brain is restored, and now your nervous system can control that area again and do housekeeping. Then we heal the gut lining, we use supplementation, we do allergy testing so you avoid the things, at least for a while, that causes inflammation, and that you eat food that really supports and helps your system. And we also look for underlying infections in that system that may be tripping us up and slowing things down.